Amgen, AstraZeneca, Bupa, Cigna Healthcare, City Cancer Challenge, Environmental Defense Fund, Gavi, Merck, Pax Sapiens, Philips, Reckitt, Seed Global Health, and Viatris. You have postcards on your chairs. The agenda and speakers can be available via the QR codes there. And you also have FP magazines that are floating around as well. If you're not a subscriber, we have a handy discount QR code in there. You should sign up, and I will ask at the end if you have subscribed. So get ready for that. Thank you for coming. We have so much content to cover, so we're going to get right into it. Look forward to it. Thank you.
Please welcome Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, and Dr. Vanessa Carey, WHO Special Envoy for Climate and Health and CEO of Seed Global Health, for a fireside chat with Foreign Policy's Editor-in-Chief, Ravi Agarwal, on the pathway to healthy planet and people.
Hello, everyone. Great to be back here. Thank you for being here. Thank you for spending time on this particular issue. And a big thanks to Dr. Tedros and Dr. Vanessa Carey for making time in their very busy schedules this week for us. Dr. Carey, I thought I'd start with you. We were just chatting earlier about how it's so easy for health to be siloed when, in fact, it is so connected as this underlying factor on every other discussion we have, and we're here specifically to talk about health and climate and how they interact. But tell us how you see that in your work around the world.
Absolutely. I think that without question, as we frame what's happening in climate change right now, climate change and health is not a new topic, just to start with. It's just an acceleration of existing health problems that we have failed to solve. And at the crux of those existing health problems is the reality that health is fundamental to everything that we do. It is quite literally the difference between whether or not you go to school, you can care for your child. It makes a difference as to whether or not your family lives above or below a poverty line. For a country, it is your GDP and your macroeconomic growth. It is migration, which is getting accelerated in climate change now, where we're expecting 1.2 billion climate migrants by 2050. That puts on a political pressure for resources. And so health is, we don't think in these terms all the time, which is why it's lovely to have health discussed at foreign policy. But that's what's so fascinating to me about the climate discussion. Because in climate discussion, we talk about it in terms of degrees Celsius averted, not in terms of lives saved. And at the crux of this, when we're talking about a phase out of fossil fuels, we actually have to talk about a phase out of fossil fuels and a just transition, because that is what is going to save lives. Millions of lives. It is going to be critical to our survival to mitigate that harm. And so we have a deep responsibility, I think, to stop thinking about health in a silo and to start thinking about how it relates across everything that we do. And at Seed, and I would argue beyond that, as we speak of silos, we address healthcare in silos too. We think in vertical problems rather than in thinking horizontally. We have an opportunity to accelerate our climate response, and we have felt this at Seed through focusing on health system strengthening and looking at the ways that we can meet all disease burdens. Seed has trained 42,000 doctors, nurses, and midwives in the last decade. And with our 2030 strategy, we're looking to 100,000 more. And we see them on the front lines of climate resilience. Because what they're doing, for example, family medicine physicians that we are training in Malawi and partnering with the governments to train in Malawi and Zambia, they can take care of 80% of problems, health problems that you see in communities, many of which are being driven by climate change. So that horizontal flexible response is our climate resilience. It is our adaptation, but we also have to make sure that we're thinking about the mitigation of harm in the first place, which is a phase out of fossil fuels, and that is critical to our health conversation.
That's really well put. Thank you. The question is how, and I'm going to build on that in a second, but Dr. Tedros, let me bring you in. How are you thinking about the immediate crisis of getting help to vulnerable populations around the world? And then you have a longer term crisis as well, which is building health resiliency around the world. Big challenges. I don't know where the money is, but push us towards solutions here. Where are they? What do you need to get that done?
Yeah, thank you. I think First of all, thank you for this opportunity. I just came back from Sudan, and in order to see the refugee situation in Adre, this is on the border with Sudan, the Chad-Sudan border. I have been to Chad. And when we were flying in, we could see a flood, and the country is flooded, and more than 500 deaths, and millions have been, hundreds of thousands of people have been affected. The reason I wanted to tell you this is, first of all, the Sudan situation is very, very tragic. Half of its population needs food aid. A quarter of the population actually has been displaced. And what you hear there is horror stories, and Sudan is forgotten, and this is not right. So I just wanted to say that because this forum especially is very important. And then on Chad, the flooding means, climate change is real. I think that's where we should start. It's around us, meaning with flooding, for instance, it means cholera. With flooding means it could be malaria, dengue, and so on.
Dr. Tedros, if I may, this audience in particular is converted on this issue. We know climate change is real. We know the scope and scale of the problem. Push us towards solutions. What do you need? Where does the money come from?
Yes, so on the vulnerable, you said, first of all, it should be our agenda should be health-centric. And she said it, and I don't want to repeat. And then second, I think we should start from the most vulnerable, from the last. We need to focus on the vulnerable population. And then the third is we need to use the resources wisely, meaning targeting those populations, affected populations. And then from there, of course, you can move to the rest because resources are limited. But at the same time, the focus of the COP29 upcoming, I met the president this morning, their focus is on climate financing, which is good news. So how can we advocate aggressively to make sure that what the COP29 presidency is planning is happening, meaning successful resource mobilization, because without resources we cannot do the things you said. But I was really happy. But the other thing he said is, with the existing resources, the processes they have is very archaic. It takes a long time to get the resources. Even when the resources are there, you don't get it quickly. So the process should be improved.
How do we fix that?
No, now the presidency is committed to change that, to improve the processes. So the resources can be expedited. I mean, the process could be expedited. So those who need the resources can have it as soon as possible.
Got it. Vanessa, you're going to jump in.
I do want to jump in because I think when we talk about the solution, one, we cannot think in silos even in climate, right? We shouldn't be diversifying the climate conversation into mitigation and adaptation and resilience. We need them all, and they all come together, and there's co-benefits to both. And I think that that's a critical opportunity in COP29 to bring that forward as we talk about climate financing, we talk about human capital, and we build on what started in Dubai with a very strong pronouncement and launch of a health day and bring it forward into future COPs, which you'll hear about shortly. So we can't silo that conversation. But I just came from the UN this morning where I heard the Deputy Minister of Health from Mozambique note that 90% of his health facilities are highly vulnerable to climate change. How do you provide services for a population, keep them safe, and be able to actually ensure that they have the opportunities they need, the resilience to protect them in the way that the WHO has been doing such an extraordinary job for a long time? And it's through accountability. And the truth is, we have to be more accountable as we sit here in our chairs in New York as a community. The resources exist in this world. We just aren't mobilizing them, and we're not mobilizing them fast enough, and we're not directing them to vulnerable populations. At COP28, $1 billion was announced for climate and health. Over 800 million of that was already earmarked and already pre-spent. We have to be honest, too, about what we're doing and honest to our partners in Mozambique, and we have to be able to deploy the money flexibly and quickly behind country-led plans. this is possible. We are doing this through the Lusaka agenda and really trying to read through financing that goes behind country-led. And we have to, again, I think in the same way that Dr. Hedges was also pointing out, is to take the health conversation out of its health silo and introduce it deeply into the climate debates. It needs to be embedded in the NDCs. We need to have health metrics, and we need to stop thinking about it as a sunk cost, but rather as an investment.
Dr. Tedros, let me bring you in on that.
So I would like to add to her, maybe.
Please.
I don't know if you're asking the same thing, but resources, as she had said, are not the problem. The priorities of our leaders are the problem.
Yes.
For instance, the defense expenditure, staggering 2.4 trillion US dollars. If you take that, what we're asking for climate change, it's a rounding error compared to the defense spending.
I'm with you, but I'll point out every conference I go to these days, they're asking for more defense spending, not less.
And that's what I'm saying.
Defense.
So the sad part is,
great point.
in many of the meetings I have attended, leaders proudly announcing that they're increasing their military expenditure. Proudly. Few years ago, was embarrassing to say that. Now, but of course there are conflicts. If they're thinking that they can only solve it through military means, they're wrong. Instead of spending all this money for the wrong reasons, it's better to find political solutions. Political solutions. By the way, the most courageous choose peace. So they should push in that direction. And we need leadership for that. Otherwise, we have resources.
I'm with you on that, Dr. Tedros. And most of what I cover as a journalist is conflict these days. And you're right, people want more defense spending because they see that as an existential crisis. What you're saying is so true in that healthcare spending is defense spending. And I wish we could reframe that. Let's try and reframe it together. One last quick question to you, Dr. Tedros. The pandemic was really rough on the world. I think it really hurt trust in countries and in their sense of equity in the global system. You know what I'm talking about. You've written about this for FP. Just tell us quickly how you can re-inject more trust into the global system.
Trust into the global system is very, very difficult, especially with all the misinformation and disinformation. And the challenge we're facing now with the pandemic agreement, with all the misinformation circulating, I think everybody's witnessing it. This pandemic agreement is a negotiation between member states and for member states. And when agreed, it will be implemented based on their national laws. But what's circulating now is as if WHO is going to take over or WHO is going to be dictating lockdowns and so on, which will never happen because what is circulating is actually a lie and a misinformation. So the solution for this, for instance, because trust should be tailored to some specific issues, the member states should come out and say this is a negotiation between us, for us, and we will implement it based on our national law. And there is nothing that will be a world government, that some people are saying, that will dictate or, what do you call it, tamper into their democracy. So I think for trust to come, the member states themselves, the 194, should come and say it, tell the truth. Then, at least, if everybody says it in their respective countries, trust could come. But many countries are quiet, almost all of them, to be honest.
Yeah.
They're quiet, despite all the misinformation that's circulating. We cannot say it, WHO, because WHO is not negotiating, or we're not the one who is going to write the negotiations. It's the member states, belongs to the member states, and the member states should defend it. And it's in each country, whatever they say and do, telling the facts that can bring back trust, and how this pandemic agreement can help in preventing the same crisis like COVID from happening. They should tell them, and they should promise that, because that's the intent of the agreement or the treaty, to prepare the world to prevent the next pandemic.
I couldn't agree more. Unfortunately, we're out of time. There's always this moment where your clock is counting down and then it starts counting up. I want to say just two quick things before I let you go. One, I often write and talk about how the UN is paralyzed. It is, but conversations like this give me a lot of hope. And second, I think what Dr. Carey said is going to stay with me for a while, and that is that healthcare is defense. It's a good defense. And I think that's something we should try and popularize because it's a great line. Thank you very much to Dr. Tedros and Dr. Carey. Thank you in the audience.
Thank you.
Please welcome Professor Maha Taisir Bakr.